Hey guys, this is part 2 of the previous model paper 2. So let's start with the questions. Government opium factory is at Ghazipur, Izzatnagar, Lucknow or Calcutta. Option A, Ghazipur is the right answer. 52nd question. For a solution to be isotonic with blood, it should have the same pH, specific gravity, osmotic pressure, or solute. Answer is option C, osmotic pressure. Haemophilus influenza causes meningitis, cholera, conjunctivitis, anthrax. Haemophilus influenzae invade the fluid surrounding the spinal cord and brain and causes meningitis or swelling in the spinal cord and brain. Moving on to the next question. Premises licensed for the sale of drugs which have a qualified person wherein the drugs are compounded is called drug vendor, drugstore, chemist and druggist, or pharmacy. So the answer is obviously option D, pharmacy, where the qualified persons are pharmacists, wherein the drugs are compounded and the premises are licensed for sale. Colligative properties are useful in determining solubility, sterility, tonicity, or stability. The answer is option C, tonicity. The next question is, mail order business is wholesale trade, retail trade by post, or direct selling trade. The answer for this question is option C, retail trade by post. Amblyca officinalis is the botanical name of Punarnava, turmeric, amla, or tulsi. Amblyca officinalis is amla, option C. 58th question. The source of codeine is bhang, LSD, coca, or opium. So codeine is an alkaloid prepared from opium or morphine by methylation. Colchicum is used to treat peptic ulcer, CCF, gout, or arthritis. Colchicum is used to treat gout attacks. So gout is sudden severe pain in one or more joints caused by abnormally high levels of uric acid in blood. 68th question. The gas used for sterilization of pharmaceuticals is sulfur dioxide, nitrous oxide, ethylene oxide, or cyclopropane. Answer is ethylene oxide, which rapidly penetrates packaging items to be sterilized at temperature tolerated by almost all materials. Tetanus is caused by Clostridium difficile, Clostridium tetani, Clostridium botulinum, or Clostridium perfringens. The answer is option B, Clostridium tetani. Spores of tetanus bacteria are everywhere in the environment. Spores develop into bacteria when they enter the body. Tetanus is not communicable. In the drugstore, the expiry dated formulations are called scrap items, surplus items, obsolete items, or dormant materials. The answer is option C, obsolete items. Riboflavin is vitamin B1, vitamin B2, vitamin B6, or vitamin B12. Vitamin B2 is otherwise known as riboflavin. Moving on, lignified trichomes are present in dash crude drug, lobelia, buchu, mint leaves, or nux vomica. So lignified trichomes are present in nux vomica. Schedule C, as per the Drugs and Cosmetics Act, deal with the following: standards for cosmetics, biological and special products, life period of drugs, or generic drugs. So, Schedule C deals with biological and special products. Natural protein used as binder is albumin, gelatin, fibrinogen, or tragacanth. Gelatin is able to form strong films and displays adhesive properties. So answer is gelatin. 67th question. Cisplatin is classified as an antioxidant, antiseptic, antineoplastic, or antiepileptic. So, cisplatin is a potent chemotherapeutic drug that is anti-neoplastic, which is used for the treatment of many malignancies, many different types. Saline purgative is magnesium chloride, magnesium sulfate, magnesium oxide, magnesium nitrate. So magnesium sulfate causes water to be retained in the intestinal lumen, thus increasing the volume of contents in the bowel. Dusting powder contains boric acid, borax, zinc oxide, or zinc sulfate. The right answer is A, boric acid. Moving on to the next question. The insurance covers a risk of loss due to theft or specified happenings is life insurance, marine insurance, fire insurance, or general insurance. So the answer is D, general insurance. In the formulation of tablet, Glidant is what? The options are lactose, gelatin, starch, or talc. Glidants are used to enhance the flowability of powders, and the answer here is talc, option D. Silocaine is brand name of benzocaine, procaine, lignocaine, or cincocaine. The answer is option C, lignocaine. Silocaine is lignocaine. Drug of choice in the treatment of anaphylactic shock is adrenaline, noradrenaline, isoprenaline, or ephedrine. Adrenaline or epinephrine is the first line treatment for anaphylaxis and acts to reduce airway mucosal edema, induce bronchodilation, etc. 74th question. An even distribution of color on the surface of the tablet is known as chipping, lamination, mottling, or capping. The answer is option C, modeling. 75th, alkaloid used to treat bronchial asthma: emitin, ephedrine, ergometrin, or strychnine. Ephedrine is used for temporary relief of shortness of breath, chest tightness, and wheezing due to bronchial asthma. A substance that kills microorganisms but not bacterial spores is generally defined as germicide, bactericide, sterility, antiseptic. So the answer is A, germicide. Moving on, which of the following is an atropine-like drug? Carvedilol, ipratropium, retrover, dimicarium. Ipratropium is the answer. It is an anticholinergic drug used to treat symptoms of COPD and asthma. 78th question. Sulfonylurea drug indicated for the treatment of diabetes insipidus: glipizide, tolbutamide, glyburide, chlorpropamide. The right answer is option D, chlorpropamide. Opacity agent is zinc oxide, silicon dioxide, titanium dioxide, magnesium oxide. So opacity agent is added to make the system opaque and less transparent. Titanium dioxide is the answer for this. Lithium carbonate therapeutically used to treat schizophrenia, mania, insomnia, epilepsy. Lithium helps reduce the severity and frequency of mania. Plague is caused by Klebsiella pneumonia, Treponema palladium, Yersinia pestis, none. Plague is caused by Yersinia pestis. Moving on to the next question. The total daily adult dose of atenolol is 25 to 50 mg, 25 to 100 mg, 25 to 200 mg, 100 to 200 mg. The daily dose of atenolol is 25 to 100 mg. Muscle relaxant is acetylcholine, succinylcholine, choline salicylate, cholestyramine. So the answer here is option B, succinylcholine. 84th question. Xylometazoline is classified as nasal decongestant, local anesthetic, antitussive, emetic. So xylometazoline is the nasal decongestant. An inactive substance which is converted into an enzyme activated by another enzyme is zymogen, holoenzyme, prosthetic group, coenzyme. The answer is zymogen or proenzyme, which is an inactive precursor of an enzyme. 86th question. The absence of secretion of urine from the kidney is nephritis, anuria, uremia, anorexia. Anuria is a condition where the kidneys fail to excrete the urine. The degradation of riboflavin by light is classified as racemization, photochemical degradation, reduction, or oxidation. So degradation by light is photochemical degradation. A drug useful in the management of nausea and vomiting is metoclopramide. ondansetron, sumatriptan, cisapride. Ondansetron is the answer. Radio-opaque contrast media for the X-ray examination of GIT is, the options are barium chloride, barium sulfate, magnesium sulfate, calcium sulfate. Option B, barium sulfate is the answer. When a solution containing 1 gram equivalent weight of substance per liter is called molar solution, normal solution, percent solution. Option C, normal solution is the answer. High technology medical development exists in budget hospital, elite hospital, medium hospital, cancer hospital. The answer for this is option B, elite hospital. Patient with bone problem goes to which hospital? Ayurvedic, maternity, orthopedic, pediatric. The answer obviously is option C, orthopedic hospital. License required to open a new retail drugstore is issued by drug inspector, drug controller, government analyst, registrar. The answer is option A, drug inspector. Moving on, adult daily oral dose of cetirizine is 10 mg once, 10 mg twice, 20 mg once, 20 mg twice. Cetirizine dose is 10 mg once in adults. 95th question. Avil is a brand name of chlorpheniramine maleate, pheniramin, promethazine, diphenhydramine. Avil is chlorpheniramine maleate. The mechanical device with the least risk of pregnancy is condom, diaphragm, IUD, oral contraceptive. Intrauterine device is the answer. Less than 1% of women with copper or hormonal IUDs get pregnant each year. Moving on to the next question. All are electron donor groups except the options are NH2, OH, NO2, halogen. The answer is option C, NO2. It is an electron withdrawing group as opposed to the rest of the three, which are electron donating groups. The most suitable route for administration of insulin is IM, IV, SC, IV bolus. Insulin is injected subcutaneously, that is, into the fat layer under the skin. 99th question. Egg yolk is used as suspending agent, emulsifying agent, binder, preservative. Egg yolk is an emulsifying agent. And the last question is the reproducibility of results of a number of experiments is generally known as bias, accuracy, closelessness, precision. The answer for this is option D, precision. So there we have completed the model paper 2. Make sure to check out part 1.